In the Netherlands, the same as in other countries, information gets more and more important in the healthcare system, and it gets more and more vital to share information from one professional to another, because more professionals are involved in the healthcare process. And what is also happening is that it is more and more important to share information with the patient, because he gets becomes a partner in the healthcare process. In the Netherlands, this is really an issue for many years. And the early years of this century, the Dutch government tried to set up a national infrastructure for healthcare information exchange. However, in 2011, the parliament decided that this should not be a task for the government to organize such a health information infrastructure. So at the moment, this health information infrastructure is continued under private direction. And this is quite effective, but it is not fully operational in the whole healthcare field. And a new development that started some years ago was the development of an infrastructure to allow patients to organize health information in their own health environment, digital health environment. This is called MedMij, and MedMij is a set of procedures, agreements, which allow private parties to organize personal health environments where patients can access their health information in a safe way, and where they can add information, and that also can be used for the patients to take responsibility for health and to share information with healthcare professionals. What we have at the moment is a number of larger national programs, and the first that was launched was a program among the general hospitals in the Netherlands, which was a large program giving them an incentive to create patient portals. And patient portals are digital environments where patients that have access to this hospital can see their own medical data. And this program is now rolling out, and what we see is that the number of hospitals that create portals for patients to have access to their data is rapidly increasing because of this program. And this program also gives sort of a step up towards personal health environments. That is the program that I discussed in the earlier question. Now what we're now seeing is that this kind of programs are also launched for the primary care, for care institutions, for mental care. So through these national programs, we rapidly see that in the Netherlands, patients can have several services offered, including service to have access to the information, but also including the service to make digital appointments, to do e-consulting, to add information, to fill out questionnaires and things like that before entering the hospital. What we understand is that the Dutch healthcare is to a large extent digital, and exchange of information, medical information in that field, we are also relatively high developed, especially in primary care. So the exchange of information between GPs and pharmacies is quite well developed. We're doing quite well, but this is something that was developed and started in the last century. And what we now see is that there needs to be some transformation leading towards the technological opportunities that we have coming towards us. And one of these is, of course, patient empowerment and all sorts of services in which patients can take a bigger role in their own health care. But the other ones are things like artificial intelligence, using these data to understand healthcare, to understand healthcare where it is effective, to create policy information. And in this respect, we are really building up. We have different initiatives, different pilots, different projects, but on a national base, this is really an area of development rather than an area where we have really fully developed. it is, what is the glass half full or is it half empty? I sense that in the Netherlands politicians and the healthcare field are very ambitious and feel that it's not going fast enough, where at the same time we see that on the international scale we're not doing that bad. But there are several successful applications. The national health infrastructure that was developed early in the century is now taken over by a private initiative, which is actually a private initiative which is governed by all the healthcare players. So it's not really private, but it is, it's private hands. That application is really including a lot of patients. I think the majority of the Dutch patients are included in that, and I think the majority of the medications information is shared through this infrastructure. And as we have an opt-in system, so people actively need to say that they want to have their information shared, I think this can be called really a huge success. And in addition to we have several promising applications. We have, for instance, teledermatology, where at the GP session you can have a picture taken of your skin disease, which is sent to the dermatologist in the hospital, which then gives teleconsultation feedback to the GP, and you don't need to go as a patient. Don't need to go to the hospital, and the GP can help you. This is really a widespread application in which it's quite innovative, you might say. So we have several of these pilots which are promising. And of course, we think that the widespread use of patients accessing their information, using medical information, and also providing input in the healthcare process, that can be quite promising and create a paradigm change in healthcare in the coming years. If any country experienced that, it should be the Netherlands, because we had really heavy debates, also resulting in the decision in Parliament, in the first chamber. Actually, we have a twofold decision parliamentary process. In the second chamber, there was agreement with the national infrastructure, but in the first chamber it was rejected in 2011, and that was really a setback for e-health development in some way, and it was caused by concern about privacy to a large extent. So the sensitivity to trust is highly developed in the Netherlands. I think the key for the current success is that healthcare players are involved in the decision makers, so it's not a top-down but really a bottom-up process, and we use the patient as the center, as the core and the source of the information. And of course, the patient needs to have access to his own information. It owns the information. One of the things that is really being built up at the Netherlands is the model of shared decision makers, shared ownership, and that is done through a so-called information council, in which all the stakeholders participate, and together they actually define the direction for e-health development and e-health strategy. So not the government decides what needs to be done, but the healthcare players together decide. And of course the government chairs this meeting, but is not giving direction. That direction is made by the healthcare players. The financiers, the payers, the hospitals, the professionals, they all sat together in this information council, and they decide for the direction to be taken. And that is the Dutch way to create trust and to involve the patients, and to create an atmosphere that patients are dealt with securely, privacy is being respected, and at the same time the safety of healthcare is and therefore you need, of course, information exchange, because otherwise you cannot make the right decisions. So we try to combine all these aspects. That is a big issue in the Netherlands, and of course also a big issue in Europe with the regulations that came into effect on the 5th of May. We have a system in place in which every healthcare professional has a card, and he can only access data through any exchange information through the UZI card. This is a system which has been operational for several years and makes sure that it's always visible and always transparent who looks at what data. So if any doctor or nurse looks at data of patients that is not treated by this doctor or nurse, it is visible. And actually, quite recently, we had a case where a celebrity was in a hospital, and it was found out that some I think even 80 professionals looked at her data, and these professionals were not treating this patient. And that was really a national issue, and the 80 persons, the 80 doctors and nurses, they were getting a penalty or reprimandas that they should never do this again. So this is done through this personal card that professionals have. The other thing is that, of course, if you get to the situation that patients have access to their own personal health environment, you also need to have a situation where patients can identify them uniquely. And this is actually being developed at the moment in the Netherlands, because this is not only happening for patients, but also for civil servants. And healthcare data are considered to be the most privacy sensitive data, which require the most high level protection to safeguard that you are really you when you're looking at your medical data. Systems to develop this at this high level are being developed as we speak. And this is really a matter of high interest at the moment in the Netherlands. If I look ahead for 5 years with what's happening at the moment, we see that hospitals are really aware of the facts that the future is not bigger hospitals, but it is rather smaller hospitals and more healthcare around the patients, near the patients, and the people that are around him. So from a face-to-face contact, it will probably become more an online contact and a contact within the home setting. And you see that actually all sectors in healthcare are preparing for that, are talking about that, and are thinking about the implications of that. I think that is a major development for the future, and might change the roles of hospitals, might change the roles of GPs, and might actually also change the role of regions, which can play a more central role in organizing health information in the region. The other thing which is of great interest is artificial intelligence, decision support, both towards the professional as well as to the patient and for clinical research. And one of the things which is really needed for that is unity of language. Unity of language all across the healthcare system and with the patient, so that if you reuse data for other purposes, you know exactly what these data mean, so that you can combine data. So these are topics which are very important.